Good afternoon, Doctor. This is Norman Regine Madrid, and I'm presenting a Simtack Tactile digital twin. So, the problem we are trying to solve starts with how triage is normally done in hospitals. So, when a patient comes to the hospital, the healthcare worker usually needs to ask questions, and the patient has to explain what they are actually feeling. But imagine a deaf patient who cannot communicate easily with the healthcare worker, or someone who cannot speak the language being used by the doctor. These people may end up wanting to get a family member or any other person to help explain their symptoms. And this creates a privacy problem, especially when the patient is talking about something sensitive. And then another issue is that if the healthcare worker cannot understand what the patient is trying to communicate, their behavior may be misunderstood as agitation instead of a sign that they are physically unwell. So this can cause a serious condition to be missed. So to solve this, instead of asking the patient to explain everything using speech or writing, we give them another way. We are trying to create another way for them to communicate on a phone or a tablet. So the patient sees a 3D model of the human body. If something hurts, they can simply touch that area and show how pain moves or spreads through their body. Then they can also use gestures to describe the type of discomfort they are having. So at the same time, the device can collect body measurements such as the heart rate, and then the system brings these different pieces of information together to help the healthcare worker understand the patient's condition and how urgent it may be. So basically, Simtack changes the patient from someone who has to explain everything verbally into someone who can directly show what they are experiencing. And so we designed this system in 4 layers. So, and the first is the agent layer, where the patient interacts with the system. Their touches and gestures are captured together with the body measurements, such as the heart rate. Then the information moves to the data layer, where it is cleaned, stored, and protected. And then the next layer is the inference layer, where the system analyzes the information and helps to determine the level of urgency. So finally, we have the implementation layer, where the useful information is prepared for the healthcare worker. Then it can also be encrypted and shared through the QR code, including the patient's access needs. So the simple flow is basically patient interaction, data processing, and finally how the information reaches the doctor. So for the tech stack, we are using for front end we are using Flutter and Dart for the mobile app, and then we are using the mobile interface to give a 3D body interaction. And then for back end, we use Fast API with Python, and then for the database, we are using PostgreSQL, which is hosted on Moon, to store the system information. And then finally, Docker for containerizing the image to ease the deployment. Then we need to evaluate our system, such that because we need to know whether it actually works for the people we designed it for. So for example, accuracy. Here, if the patient selects an area on the body, we check whether the system identifies the correct area. For measurements such as the heart rate, we can compare our results with a trusted medical worker. Then for functionality, we test the complete process. For example, we check whether a patient's touch is captured and fully processed, and then eventually reaches the clinician. And for usability, we look at whether a patient can use the system themselves without any assistance. Like for example, can a deaf patient report the symptoms without needing help from another person? Then we have privacy and dignity. This one ensures that like patients use this system independently without while keeping their health information private. Then we have performance, like how many people can this system accommodate at a given period of time. Then lastly, we have the data. So the system works with several types of information. So we can collect the patient's touch and gesture information, then the body measurements such as the heart rate, and the system, and then as the results produced by the system. So because of this sensitive information needs to be protected. So we encrypt that information and share it using a QR code. So the one that the patient uses to move from one clinical station to the other. Then for development and deployment, we are storing our code on GitHub, and then front end we are building APKs. We are building an APK and then a web via GitHub Actions. So we write a workflow that guides the GitHub Actions to build the APK and then the web. Then back end we are using Docker, which we are using Docker, which we deployed on render. Then our database is on Neon, so we connect Docker, we connect render with Neon. Then after we connect the back end to front end. So that's it. Thanks so much.